Hello, my name is Beck Williams, and I'll be demonstrating on how to properly perform hand hygiene. We need to always perform hand hygiene before and after we eat, after we use the restroom, in between patient care, if we think we've possibly been contaminated, and if our hands are visibly soiled. And we also, especially with the coronavirus going on, we need to also perform hand hygiene as much as possible. And we also need to perform hand hygiene to prevent infection and contamination between patient to patient, patient to healthcare worker, or vice versa, healthcare worker to patient. Before I demonstrate, you need to make sure you're away from and not touching the sink or counter. Make sure you don't get anything on your uniform. When you cut the water on, make sure it's warm. When you wet your hands, checking for cuts and scrapes on the hands or around the cuticles. You get 3 to 5 milliliters of antiseptic soap. Rub the palms together at least 5 times. You rub the back of the hands at least 5 times. Make sure you keep your fingertips and forearms below the elbows. You want to interlace your fingers, palm to palm. You go to the back, interlace both hands at least 5 times. Since our fingernails contain so much bacteria, you want to make sure you clean those, going in circles in your palms at least 5 times. Make sure you get your wrists. You wash the soap, rinse the soap. Make sure you don't touch anything in the sink or around the sink, because it could possibly contaminate your hands and you have to start over. And you get a paper towel, dry your hands, fingertips to wrist, fingertips to wrist, fingertips to wrist, fingertips to wrist. You want to get a dry paper towel, turn off the faucet.